Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. This is Muzdalim from Shaita Islam Medical College. So now today's our topic is popliteal fossa and leg. First of all, seat stores. Here are 7 MCQ and 2 SCQ from Lord. Now starting our chapter, popliteal fossa, it is very important UQ. You have to know about its boundaries, its superficial and deep relationships and its contents. This one. And this one is the popliteal fossa on the back of the knee. And this diagram represents the structures present in popliteal fossa. Then tibial nerve, it is very important for SCQ point of view. Then common fibular nerve, it is also important for SCQ point of view. You have to know their origin, courses and branches. Blood vessel, popliteal artery, it is also important for SCQ point of view. And you have to know about genicular anastomosis. This diagram is important. And you have to know about the genicular anastomosis. This one. Then lymph nodes, it is important for MCQ and SCQ point of view. Then anterior compartment of leg. You have to know about the function of anterior compartment of leg muscles. Then here are some highlighted points for MCQ, and this one was about the retinaculum, superior extensor retinaculum and inferior extensor retinaculum. And next is the muscles of anterior compartment of leg. They are the dorsiflexors of ankle joint. Then here are the muscles of anterior compartment of leg. You just have to read all these muscles for MCQ and conceptual point of view. Then this table is important to see the anterior and lateral compartment of leg and the muscles, their attachment, their innervation and their action. It is important for MCQ and SCQ point of view. Now we move on to the nerve of anterior compartment of leg, that is deep fibular nerve. It is also important for SCQ point of view. This table is important to see the nerves of the leg and it is important for MCQ and SCQ point of view. And next is the artery in the anterior compartment of leg, anterior tibial artery. It is very important for SCQ point of view and also for viva point of view. Next, this table shows the arteries of leg. You have to read all these arteries, their origin, courses and distribution. Then we move on to the lateral compartment of leg, and you have to know about the muscles and the function of lateral compartment of leg, that are the vertebras. And here are the superficial fibular nerve. It is important for SCQ point of view. Then we move on to the posterior compartment of leg, flexor retinaculum. It is important for SCQ and MCQ point of view. Now you have to know about calcaneal tendon. It is important for MCQ and SCQ point of view. This table is important to see the superficial muscles of posterior compartment of leg. Now this yellow highlighted points, it is important for SCQ and MCQ point of view. And this table is important to see the deep muscles. It is also important for SCQ point of view. Then here is about soleus. It is important for MCQ point of view. Just have to read all these. Plantaris, it is a vestigial muscle. It is important for MCQ point of view. Popliteus, you just have to read it for MCQ and conceptual point of view. Next, here are some MCQ yellow highlighted points, and just have to read about the muscles. Then nerves in the posterior compartment, tibial nerve, it is important for SCQ point of view. Posterior tibial artery, it is also important for SCQ point of view. Fibular artery, just have to read all these for SCQ point of view. And now we move on to the clinical box. Now popliteal aneurysm and hemorrhage, it is important for MCQ point of view. And injury to tibial nerve, it is important for SCQ point of view. Shin splint, it is also very important for clinical point of view. And next one is the foot drop, it is very important for UQ and clinical point of view. Here is about gates. You have to know about the types of gates. Calcaneal tendinitis, it is also important for MCQ point of view. And tennis leg, it is important for SCQ point of view. Calcaneal tendon reflex, it is important for MCQ point of view. And calcaneal bursitis, it is important for SCQ point of view. Our chapter is end. Hope so you can understand. For better preparation of Prof, you can avail services from Medical Globe Book MBBS Cracks. Thank you. Allah Hafiz.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and supply solved university questions, questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks, encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and the MBBS cracks at your doorstep by placing your order at 0335 66 33007.